Welcome back, dear listeners, to another episode of Dermatology Insights. I'm your host, Dr. Alpna, your friendly neighborhood dermatologist. Today, we are taking a detour from our usual skin health tips and diving into the fantastical world of Westeros. Yes, you heard me right. With the second season of the House of Dragon wrapping up, I thought it would be the perfect time to revisit one of the most intriguing and tragic characters from season 1. King Viserys, or as I like to call him, the king of awkward skin conditions. For those of you who might be new to the show or to the world of Westeros, let me give you a quick refresher. House of the Dragon is a prequel of the famous Game of the Thrones series. It's set centuries before and following the legendary Targaryens during their most powerful era. King Viserys, a central figure in the story, ruled during a time of relative peace, but faced a hell lot of personal and political challenges. Among his many struggles was a mysterious and debilitating skin disease that plagued him for years, ultimately leading to his demise. In this episode, we'll be discussing the hypothetical case of his dermatological illness. So let's set the scene. King Viserys of the House Targaryen, first of his name, King of the Andals and the Rhoynar, and the First Men. But beyond the titles and the dragons, Viserys has a royal secret. A crazy skin disease that plagued him for 20 years. And boy, was it a doozy. King Viserys presented with various symptoms including skin lesions, open sores, rotting of the flesh, drinking, dementia, bureaucratic migraine and disappointment in his brother. On initial clinical examination, the king had purulent exudates and necrotic tissue on the back, which were thought to be caused by sitting on the Iron Throne for prolonged periods. However, as the disease progressed, it manifested into further symptoms such as recurrent bouts of cough and putrefaction of the flesh. It even resulted in the use of maggots for debridement. A presumptive clinical diagnosis of leprosy was made by examining and observing the king's symptoms, considering the limited diagnostic means available in the medieval Westeros. Differential diagnosis considered included pyoderma gangrenosa and necrotizing fasciitis. Treatment for the king's illness was extensive and included leeches, maggots, herbal tea, and cauterization prescribed by the Grand Maester Mellos. Despite the efforts made by the Citadel Maesters to preserve his limbs, King Viserys gradually lost 2 of his fingers, then the lower portion of his left arm, and eventually his right eye, resulting in a rather distinctive pirate-like appearance. As the disease progressed, King Viserys developed severe facial necrosis leading to necrotic tissue and mutilation of maxillary bone. Unfortunately, the patient succumbed to his illnesses, which proved progressive and ultimately fatal. His legacy lives on through his loving wife and the little dragon children, who will probably all roast each other at any moment in true Targaryen fashion. Now let's get back to leprosy, also known as Hansen's disease. So leprosy holds great historical significance and is one of the oldest known diseases. The earliest evidence of leprosy dates back to ancient civilizations such as Egypt and India, with descriptions of the disease appearing in texts dating as far back as 600 BC. Leprosy is caused by the acid-fast bacilli Mycobacterium leprae, which is known to have an extremely slow growth rate leading to chronic progression of the disease over decades. The infection primarily affects the skin, nerves, and mucous membranes, leading to characteristic clinical signs such as skin lesions, nerve damage, and muscle weakness. The disease is primarily transmitted through respiratory droplets, though other potential modes of transmission include contact with contaminated clothing, objects, or even conjugal contact. Diagnosis of leprosy is typically made through a combination of clinical examination and lab testing, including skin smears and biopsy for acid-fast bacilli. Treatment of the disease involves using a variety of antibiotics, with the most commonly used therapy being a combination of dapsone, rifampicin, and clofazimine. Leprosy still remains a public health concern in many parts of the world that have poor access to healthcare. The World Health Organization estimates that there were more than 127,000 new cases of leprosy reported in 2020, highlighting the ongoing need for increased awareness and efforts to combat the disease. King Viserys' chronic illness can be contributed to a few factors. First, the slow growth rate of Mycobacterium leprae between 1 to 5 years allows the disease to progress over a long period. Secondly, the fact that Mycobacterium leprae primarily infects peripheral nerves, resulting in nerve damage and loss of sensation, which can lead to delay in detection and treatment. And lastly, the medieval healthcare system in the Westeros was not advanced enough to properly diagnose and treat the disease, leading to the king's suffering for 20 years. So what can we learn from this tragic tale? Well, first, always seek prompt medical attention if you notice any unusual symptoms like non-healing wounds, prolonged fever, or long-standing numbness of limbs. Secondly, if you ever find yourself in the Westeros, maybe avoid the Iron Throne. It's not just a seat, it's a health hazard. So that's all for today's episode of Dermatology Insights. I hope you enjoyed this blend of history, fantasy, and dermatology. Don't forget to subscribe, and as always, stay healthy, keep your skin happy, and always wear sunscreen. Until next time, this is Dr. Alpna signing off.